for the individual people who have chronic illnesses who would be interested in going to medical school, I say, one, please reconsider. I remember when I withdrew from medical school, my doctors were like, yeah, I don't like medicine. You probably made the right decision. I'm like, oh my God, why didn't you tell this to me before I racked up like $100,000 in loans? So I throw that in there. Reconsider. There's probably other ways you can be helpful. But if you're dead set on killing yourself, um, be prepared. Get prepared before you go to med school. Get prepared in undergrad.
Hey there, and welcome to In Sickness and in Health, a podcast about chronic illness, disability, medical traumas, and everyday uncomfortable healthcare experiences. My name is Cara. I'm not a doctor. I'm not a medical professional. I'm just a person and a patient who really wants to talk about this stuff more. Nothing said on this show should ever be considered medical advice. If you're experiencing a medical issue, please seek qualified medical help. I know the system sucks, but I do wish you a lot of luck. Each person is different, even within disease groups, so none of my guests should be regarded as official representatives or spokespersons for their conditions. Please respect their very personal choices, and unless they ask for it, please don't make suggestions about treatments or lifestyle changes. We talk about this over and over again. Unsolicited medical advice is almost never not annoying. On today's episode, we'll be continuing the conversation about our complicated relationships with medication and redirecting our plans when life and our bodies get in the way. I talked to Cyrena about her experience pursuing an MD PhD while also weathering the ups and downs of both bipolar disorder and lupus. Something that has come up again and again on this show is how great it would be to have more doctors who understand from firsthand experience what it's like to live with chronic illness. I personally would love to see that happen. If I didn't hate school so much and had the stamina, I'd even pursue it myself, but it is not a path that makes any sense for me. Cyrena found it wasn't for her either, and was able to trade her MD PhD track for just getting a PhD, which is still super impressive. She had a rough go of it, but is now nearing the end of her program and shares some wisdom with us based on her own experience. We certainly do not want to discourage anyone from pursuing medical education if that is your dream, but Cyrena gets very honest about some of the things that you might face. It won't be easy, but that doesn't mean that you have to give up your dream altogether. If I have any listeners that are currently med students, residents, doing a fellowship, or even in as like a grown-up doctor, please email me at insicknesspod@gmail.com. I would love to hear from you, hear what your experience has been. Even if you want to be on the show, I'd love to talk to you. I think it would be great for people to hear your stories. I want to preemptively apologize to my listeners in Philadelphia. I know I have a lot of you. We talk a little shit on Philly in this episode, so I'm sorry. It's a city that both Cyrena and I lived in at a time when we both felt isolated, confused about what directions our lives were headed, and first started getting really sick. Living in any city probably sucks under those circumstances. You are a lovely city with delicious food, my favorite medical museum, and a vibrant disability community. You're great, really. I've since enjoyed it much more as a tourist, but we've both had a hell of a time while living there. Cyrena will be on another upcoming episode in the new year that contains the second part of our conversation about how our bodies respond to stress and her research in that area. She's studying inflammatory markers in adults who experience early life stress, and we'll be talking about how that can contribute to or exacerbate, but not cause, the development of chronic health conditions later in life. If you stay tuned to the In Sickness and in Health blog this week, I'll be publishing a year-end list of some of my favorite podcast episodes from this year that relate to some of what we've talked about on the show so far. You can find us on insicknesspod.com and on social media at insicknesspod. As always, I've included links in the show notes for further reading about some of the things we talk about in this episode. If you could take the time to rate and review us on iTunes, it would really help a lot. I hope your 2015 didn't suck too much, but if it did, I hope that 2016 will be a little nicer to all of us. My wish is that in the coming year, we'll all do a better job of preserving basic human dignity in all things, but especially healthcare, for everyone involved. So have a happy new year and enjoy the show.
So I started college at 17 at Brown in Rhode Island, Providence, Rhode Island. I came here actually as part of their 8-year bachelor's MD program. It's called the program in liberal medical education, and the whole goal is to create more broadly educated and humanistic doctors. Blah blah blah. The other reason I came here is because we didn't have any course requirements outside of what we call our concentration. Everyone else calls their major.
Right.
We didn't have any distribution requirements outside that, which I thought was fabulous. Since, as you may know, in high school you have to take some of everything.
Yeah. Well, I went to art school just so that I would never have to take math again.
I did have to take one more math class, but I came with the intention of being a neuroscience major, which is what I ended up doing. Yeah, I sort of had this thing where like I took the intro neuroscience class and I said, if I get an A in this class, I'll be a neuro major. And I did. So that was how that decision was finalized. It's a weird way of doing it, but that's what I did. And I started officially doing real lab research the summer after my freshman year in a biochemistry lab in the summer, working on stroke. More specifically, is trying to like identify where stroke damage happens in the brain. Blah blah blah, stuff happened. I did that research for 2 summers, and then I reached my junior year, and that's kind of where things sort of crank up a lot. You have to start making decisions about, do you want to do, an honors thesis, and if you want to do that, you have about 2 years of research to do for that. And I got really sort of hyper about the whole thing. I was like, I'm going to take everything in the world. And kind of at this point, I had also decided to pick up a Hispanic studies concentration. And we don't have minors at Brown. There's no minors. So if you want to study something else, you have to do a full concentration.
Oh, wow.
So, yeah, so it's basically like getting 2 separate degrees, except you really only get one. So, that piled on more classes. And so the second semester of my junior year, it was the first time I got really severely depressed. Like, it was terrible. And I was supposed to go study abroad in Mexico that semester. So I kind of decided at the, last minute not to do so. And I think it probably kind of worked out for the best.
Yeah.
It would have been really unfortunate to be severely depressed in another language. So that was kind of where I think I would say my patient story started. And I was in a position where I knew what was going on, but it was this sort of, I'm sure some people can identify with this. It's sort of like this sort of almost denial in terms of, if I had a friend who was going through the same thing, I would say, oh, you absolutely have to go and get treatment. This is what you have to do, blah, blah, blah. But it was me, and I just sort of struggled with it for a long time until I saw that I was really, I couldn't handle it anymore. I was failing 3 out of my 5 classes. So I went to psych services here, and I went to one of my deans, and, I kind of got things together, but I didn't really recover. I just muddled through. And at this point in time, too, I was doing my thesis research, and I was doing my work in neurolinguistics, which is basically sort of how the brain creates and processes language. And somehow I managed to do that and still be severely depressed. It was really strange. It's kind of like I kept going with that. And I remember I saw my undergrad thesis advisor a few years after that, and I said, I was really depressed that whole time. She was totally surprised because I like cranked out everything,
Yeah, that's
and
really impressive.
yeah, it was really crazy. So I managed to do that. I actually finished the whole thing, um, and you know, God, I don't know how. I ended up graduating with honors, which was, I wouldn't say it was a miracle. It was like a feat of
Yeah.
sheer endurance, I suppose.
Well,
Um,
I mean, you don't have to have any sort of health problem or mental health problem for that to be a feat of endurance at an Ivy League
right?
school, you know?
Yeah. Um, so I graduated and I decided I didn't, well, there were two reasons. One, I didn't want to spend 8 years in one place.
Mm.
And two, at this point, I decided I would go for an MD PhD instead of an MD. I've been trained not to say just an MD, um, an MD. And so I took 2 years off and I, kind of went on down the East Coast to Philadelphia and worked for 2 years at the University of Pennsylvania in their cognitive neuroscience center. Um, and that was where, it really started getting going. I got depressed again, severely depressed. I think it was, a combination of biological stuff,
Mm-hmm.
and it was the being alone in a new city.
And Philadelphia in general is just super depressing. I That was where I went to art school and I hated every second of it. Well,
It
not
is.
every second, but
I say I have a love-hate relationship with
yeah.
it because, the second year I was there, I got a roommate, and I started seeing my partner more seriously. But the first year was torture. And
Mm.
then when I got there, the research I thought I was going to be doing was not what I was doing because you know, um, I'll say PI, principal investigator, who's the person doing the research. I'm going to say PI after that.
Okay.
The PI decided she wanted to do something else. So I almost felt like I got a bait and switch, right?
Mm.
So I had this city I was all alone in. It was kind of depressing, especially after being in Providence, which is actually a very nice city. Um, and being, alone and then having this sort of, already underlying trait. And I just like fell through the floor. And it was pretty bad. And as an employee, I had access to their what do they call it? EAP, Employee Assistance Program. And I called them and I said, I can't do this anymore. And they set me up with a psychologist in the psychiatry department. And I saw her for about maybe like December. No, probably more like 3 months, 3, 4 months, somewhere between that. It's been a long time. Between 3, 4 months, and she said, I don't think you're getting better. I think you should maybe see one of the psychiatrists. And I said, okay, I think that's probably a good decision to make. In undergrad, I was kind of resistant to the idea of taking medication, but at this
Mm-hmm.
point, it was sort of like, I will do anything,
Yeah.
please. So I went and I saw, because it's a university clinic, you see a resident and then you see a an attending with the resident. So you can kind of get a double team thing, right? And so I saw one of the residents, and then eventually attending, and they say, "Yep, we do believe, based on your history and your current symptoms, you have major depression. So we're gonna put you on Lexapro, and here's your pills. And you're gonna come back in a couple weeks." Well, that was really fun because I took the Lexapro and I just freaked. Like, I completely freaked the fuck out. Like I was
Mm-hmm.
crying 1 minute and I was like wanting to punch holes in walls. And I had like this hypersexual thing going on. And not, I wasn't like having sex with lots of people. I was just thinking about it all the time.
Yeah.
And I was cleaning my apartment at like 3 in the morning, and I paid off like my whole credit card, which at the time was like $2,500, which wasn't, it's not the most logical way of thinking. So I,
No, but it's usually the opposite that happens when somebody's like having a manic episode.
I
Like they
was so,
usually run up their credit card instead of actually paying
I
it
was
off.
so productive. Like my
Yeah.
apartment was spotless. I wasn't in debt. I wasn't in debt anymore. I was kicking ass at work. It was all brilliant. And
Yeah.
then, but I was still freaking out at the same time. I would like cry at my desk, and then I'd be like super social, and it was just up and down and up and down and up and down. And I called and I said, I am going crazy. And so she put me on Zyprexa for a little while until I could come into the clinic. And I went in and they said, yeah, you know, so what else did you have in your history? Like, why don't you tell us everything? So I went back and I kind of gave them a whole rundown. And they're like, well, we kind of think maybe you had a hypomanic episode that semester before, that semester when you took all those classes and never slept. So we're going to take that Lexapro from you. Why don't you just like give it to us and throw the rest out? And we'll start you on lithium. Because, they said, well, Depakote or lithium. And I knew Depakote was not good for your liver, and liver damage is worse than kidney damage. So I made that trade, right? So we're on the lithium, and I won't say it was better, but it wasn't worse. But I wasn't flipping out anymore, which was good. But a few weeks into that, I ended up having a toxicity episode.
Oh God.
Yeah, and it was really ugly. It was like stuff firing out of both ends.
Oh no.
So I had to come off of that. And so I'm in this place where I'm like off the lithium. And they put me on Lamictal, which is an anticonvulsant that's used to treat bipolar disorder.
Right. So, for people who don't know what an
Oh, yeah.
anticonvulsant is, it's a
So
seizure
it's
drug.
a seizure drug. I'm so sorry. Yeah,
It's okay.
it's a seizure drug. And at this time, it had just been approved for treatment of bipolar disorder with for maintenance. And it was kind of showed that was effective against depression, so it was kind of the right drug for me. But the problem with Lamictal is that it can cause this really severe, potentially fatal skin disorder called
Yeah.
Stevens-Johnson syndrome. So you can't just
Terrifying.
start full dose. You have
Right.
to kind of climb up to it. So I'm in this point where I don't have like lithium coverage, and I'm kind of cranking up on the Lexapro. So
Lamictal.
sorry, thank you. Lexapro was gone. So all these L's. So I was kind of in this weird like no treatment hole. But it was like there was a period of time where the sky sort of opened up and I was feeling better again. And I wasn't quite manic. I was sort of like, I wasn't hypomanic. I was like hypomanic, if that makes sense. And then at
So,
the end
like,
of
just a step below
just a
hypomanic.
step below hypomanic, I was feeling good. And
Is that, I mean, is that what normal feels like? Is that what we're supposed to feel like all the time?
I don't know if that's what it's so hard because I don't know what normal is.
Yeah, me neither.
Um, so, but I guess that's what some people would call normal. For me, it was just like, wow, this feels awesome. Because by that point, my normal was depressed. But at the end of that week, it's like the floor dropped out, and that was the first time like I was seriously close to. I went straight past suicidal ideation. I was like right up on like, okay, I'm going to kill myself. Keeping in mind, I live alone, so I could have easily done it, but I think there was probably something in my brain that said maybe you don't want to do this yet. And so I called my friend, who is now my partner, actually, and I said, I think I'm going to kill myself. And she basically kept me on the phone for about 8 hours,
Oh,
like,
wow.
and So I'm still here, and she's in the next room somewhere. But that was the one time that I was super close to it. Um, and, I think I still say to her, like, you saved my life because had I had no one to call, I probably would have done it. Um, but so I fumbled through, the Lamictal by itself is not the most effective drug for me.
Right.
I have to qualify that for me.
Right. It's important to make
Yes,
people know that like everybody's body is different. We have different
exactly.
genetic factors that influence how we metabolize medication. We have different, even just levels of adherence, whether you're taking it correctly or not can
Exactly.
drastically affect how it affects you. So, yeah, for individuals, you are
Exactly.
speaking individually.
I'm
Yeah.
speaking individually. Um, but I guess it was enough to keep me from, jumping into the Schuylkill or something. So
Which for people who aren't
it's a
familiar with Philadelphia,
it's a stinky, horrible river that runs through Philadelphia. In good presence of mind, you barely want to walk over it, let alone jump into it. Philadelphia is kind of a stinky place in general.
it is, but it's distinctly different, a different kind of stinky than New York is, which is also a very stinky place.
Right, but
But this summer I was doing a workshop at Columbia, so I was there, I was in the city every day, and then that weekend I had to go to Philly for a wedding, and I was like, wow, the hot garbage smell smells totally different here.
yes, yes, hot garbage in the summer. It's like it bakes the
Yeah, it's
sidewalks
disgusting.
and all the oh, it was horrible. And I don't know if you this total tangent, but I don't know if you remember those ginkgo trees all over Center City,
Oh yeah.
and they planted the wrong ones. They were supposed to plant male trees, and they planted the female trees. And so there were all these stupid berries in the fall, and they smelled terrible.
Yeah.
And I always called them the dingleberries because they were so bad, and they would smush in your shoes, and you drag them into the to your house, and now your house smells terrible. So
Yeah.
of course, all this on top of just kind of being dealing with a major depressive episode is, it's brilliant. It's awesome. It's exactly where you want to be.
Yeah.
Uh, so I I muddled through. I was not as successful as I would have liked to be in Philadelphia in terms of my research career, but I did get into the MD PhD program here at Brown, and so I came back at the end of my 2 years and I started medical school, and I got really depressed again. And so I went to, psychological services again. And I just said, I don't know what I'm doing. I'm really depressed and I can't deal with this. And we at the time it was like 5 sessions with someone at the clinic. So I had my 5 sessions, and then they gave me a list of psychiatrists and therapists to call in the community, which, if you're severely depressed and in medical school, you have
Oh
lots of
yeah.
time to be screening people.
Right.
So
Lots of emotional energy to go
lots
around.
of emotional energy to spare. But I called the first, doctor on the list. Um, and, she had time for me to come in the next week, which is amazing. Because as some listeners may know, it can be very difficult to get a psychiatrist. Um, in some parts of the country, it can be upwards of 6 weeks
Mm-hmm.
or more. Here in Providence, New England in general, you can throw a dart and hit like 15 of them. So it's a little easier, but that was a really quick turnaround. So I went in and I told her what was going on. And the first thing she did, she said, I'm going to put you back on lithium. And I said, whoa, last time with that was not so awesome.
Yeah.
But I went back on it and I'm still on it. Um, And I still have the same doctor. So we've been together over 10 years now.
Oh, wow. That's
I
longer
know.
than a lot of like relationships.
Right. I told her, I was like, I'm going to thank you in my acknowledgments in my thesis. She thought it was funny. And I was like, I'm dead serious. I totally am. I wouldn't be.
Yeah.
So that was kind of the beginning of my ongoing history of depression in medical school. And I cycled a lot. And when I say cycle, some people have like depressions where they're depressed for a couple weeks or a month. My depressions last, 4 to 6 months at a time.
Mm.
So I'm trying to, get through all of this. And I, at this point, was definitely not doing well academically. So I was going to have to repeat the first semester, which, sets you back a lot in it's not quite like undergrad where things are sort
Right.
of pieced off. Med school is kind of a lockstep curriculum.
Yeah. There's not a lot of room
There's
for.
not a lot of room for error.
Yeah.
And, so I was in treatment for that. And there was already kind of like some hesitation, like maybe you should take some time off. And I said, I can't take time off. I won't come back. I'd rather drag through this than not come back. So they let me stay. And by the end of my first year, they had completely redone the curriculum. So instead of having to redo just a semester, I had to redo the whole first year. So, I went back and, kind of like going up and down and up and down and up and down, like on this, like, not ever getting back to normal, but constantly like a little bit less depressed, more depressed, less depressed. That's sort of like a sine wave up and down thing.
Mm.
So I got depressed again, and I ended up doing a partial hospital program for the first time. And for those people who may not know what partial hospital program is, as opposed to inpatient where you're there 24 hours a day, partial hospital is kind of like going to grade school where you go from 8 o'clock to 3 o'clock, and then you go home. And when you're at the program, you're in intensive, therapy and medication management changes, all sorts of things. So I did that for 2 weeks, and I came out and I thought I was okay. Um, so I went back to school, but at this point, you miss a segment, you got to redo the whole damn thing.
Mm-hmm.
So so now I'm in a position where, geez, I have to repeat something else. And, I think they were probably thinking, at this point, maybe she shouldn't be here. But I guess, they just let me be there on academic warning instead of being dismissed outright. Uh, so
Well, yeah, because that way they can keep taking your money.
exactly. I guess it's in debt for a lot of money.
Oh, I can imagine.
So, you know, I I ended up uh, at some point doing partial hospital program again, and it was okay. The problem is, and I'm going to do a caveat again, for me, cognitive behavioral therapy or CBT is not terribly effective. And this program I went to was highly focused on their psychotherapy being CBT.
Mm-hmm.
So I think that's ultimately why I didn't get a lot out of it. Um, and I talked to my psychiatrist a lot about it, and I think we both agree that that's not what I need. Anyway, so I had done that twice, and so I was repeating my second year, and starting in the summer of that year, I had been having some weird stuff going on, like it's kind of having some joint pain, and like I had like um some swelling in my toes, and for about 6 months to a year before that, I'd been having these really strange hives all over the place, and not like itchy hives, but I guess hives that would be more like this condition known as angioedema, where it's like really massive swelling.
Mm-hmm.
Um, and but things started really ramping up. Like I was having, like my joints were freezing, and I had this, like, I started seeing this rash and all this stuff. And I said, well, I have an idea what this might be, but I'm going to go to health services. And so I went to the health services and I saw one of the MPs, and she said, well, you know, there's a few things this could be, but we're going to do some blood tests. And so she took blood, she checked, did physical exam and everything. And like maybe a week after that, you know, I got an email and then I got a phone call, that said, call me.
Oh, that's always fun.
It's always fun. So I called her back and she said yes. So your test came back with a positive ANA, which is anti-nuclear antibody, which basically means that my immune system was attacking the nucleus in my cells.
Mm-hmm.
So we're going to send you to a hematologist. And I said, I know what this is. Because at this point, I had discovered that I had lost two giant patches of hair. And one might ask how you might just discover you'd lost two patches of hair. Well, I have a lot of hair. And, very puffy, very, kind of like I have a, fro thing kind of going on. So it's very easy sometimes to not know you don't have hair places.
Mm-hmm.
But, I was textbook. I'm in med school. We had just started our what they called supporting structures, where they crush dermatology or rheumatology in one section. And I knew I was textbook for lupus, but I went to the rheumatologist, and they had my records from health services already. The beauty of being in a smaller place is that it's easier to share records. So they had my records and just got some information, checked me out, and took 19 tubes of blood. That is correct, 19. It should have been around 20, but
Yeah.
it's like, and I don't have a lot of veins. I had like this one little vein in my arm that was like giving up by this point. And I came back 2 weeks later. They're like, yeah, so you have lupus. And I'm like, that's great.
Yeah.
It's like, it's not enough that, I have like bipolar disorder. I also have lupus. I'm awesome.
Well,
So
why stop at one? I
why
mean,
stop at one? Why don't I just hit like, you know, everything in one
yeah.
um, and this was kind of like the beginning of the end of med school. Like I, you know, failed a couple things again for obvious reasons. And I, failed my clinical skills exam, which is like learning how to do a physical examination and interviews, because I was totally distracted. I couldn't remember anything.
Mm-hmm.
And, they just said, well, you can repeat this again, but you'll be coming up on your time limit, and maybe this might not be the best thing for you. And I'm like bawling because this is I had wanted to do this since I was a little kid, and now they're saying, well, we don't think that this is where you belong. And I was so tired. I was just so tired of fighting. I just said, you know what, um, I'm not going to let them kick me out. So I'm going to just withdraw because that looks better than getting kicked out.
Mm-hmm.
And so I withdrew. Um, and, you know, at the point that I withdrew, I didn't realize that I wasn't going to be, um, getting any loan money. So we were pretty much broke for months on end. And one of my professors was helping us out, like buying groceries and stuff like that, because
Oh,
otherwise we
wow.
had almost nothing. And, but luckily, my partner sort of, went into overdrive, and she, said to, she wrote an email to everybody and said, you were terrible people for doing this. She like sent it to everybody. I swear it was like all the administrators in the med school and the deans and everybody. But she also suggested, like you were in an MD PhD program, so there was a PhD spot waiting for you. Maybe we could try that. And I thought, you know, okay, I'll do whatever. And so that worked out. And they got me worked out a spot in the department I'm in now. Um, and so that's kind of how I ended up here. And in grad school, I went to partial um, two more times. One more at the other place. And then I went to this program that was more like existential therapy, which is more sort of thinking about who you are and what in your life might be making you, contributing to your depression. I don't know. It was a very interesting sort of thing. It's more like a higher level of thinking, I guess.
Yeah, that sounds
Yeah,
interesting.
it's not terribly common. Most places are, cognitive behavioral therapy, but this was cool because you had to think about who you were,
Hmm.
and there was a lot of thinking about what are your networks, your support networks, what's important to you in life, how do you identify what to focus on in your life. I liked it. It was a lot of fun. I still have my notes, and I go back to them sometimes. Um, but it was still a struggle. I started in a lab where it's very physically demanding. It's like 12-hour days, and you're sort of on your feet and in a chair, and on your feet and in a chair, running around doing all this stuff. And my body couldn't keep up, you know. And it was really disappointing to me because I really enjoyed it, but I couldn't keep up. And I wasn't going to do well if I couldn't be in there all the time. That's just how it's set up, like experiments are what they are. And if you can't do them, you can't do them.
Yeah.
There's only so many accommodations that can be made. If cells are dying, they're dying. So I had to switch to another lab, which is where I am now. And it wasn't, it was more a choice made out of, it was a forced choice. It was a choice kind of made out of desperation. Like, where can I go that I don't have to, engage in really hard labor?
Mm.
And it's very tough because, I'm like in a physiology pharmacology department. Like, I know people might not know this, but a lot of this work is physically demanding.
Yeah, very.
And so, that's one of the reasons why between medical school and basic research, you don't see a lot of people with chronic illnesses because you don't have the stamina,
Mm-hmm.
you know, and your body just can't keep up, with all the healthy people. So I changed labs, and been in the same lab, and I've been depressed, and I've been not depressed, and um, I've had lupus flares, and even day to day, even when you're not flaring, it's your body is not in the same place as a healthy person in the same age.
Right.
And not everybody knows that you have a chronic illness. So if you don't go to like all the department seminars, you might look like a flake.
Mm-hmm.
Um, and something that I think is really important for students, especially students with chronic illness, is to find someone who understands.
Yeah.
It may not necessarily be going through it, but at least has some idea that what it's like to, what it is to struggle and to be your champion, because there's going to be a lot of people trying to push you out.
Right.
And I would not have survived this long if I didn't have one. Who's the same professor who's helping us out with our groceries. So
Oh.
it was nice. And I guess that sort of ties into, I think, what we mentioned at some point about chronic illness in medical school.
Mm-hmm.
Um, so I have a lot of opinions about this.
Yeah. Well, in your talk from the MedX pop-up in New York, you said you were told, quote, "Chronic illness isn't compatible with a career in medicine," and I burst into tears
It isn't.
because,
I really hate to break people's hearts, but by and large, it's not.
yeah,
And it's mostly there are people who obviously are outright antagonistic
yeah.
and do not want people who are, but mostly it's just the system.
Well, I mean, it's institutionalized
It's
ableism.
institutionalized. It's
Like, there's no reason why. I mean, there are certain reasons why, you have to work these super long shifts and stuff like that for
Mhm.
continuity of care and whatnot.
Exactly.
But there's a lot in the process along the way that is purposefully built in to weed people out
Oh, absolutely.
and unfairly targets people who are dealing with disabilities or chronic illness or mental
Well,
illness.
yeah. I mean, one of the issues right up front is accommodation
Right.
in the, what you call the preclinical years when you're in the class all the time. This idea that you're seeing more and more about these like holistic curriculums where everything's tied together and you don't have discrete units is not friendly to someone who has an episodic illness.
Mm-hmm.
If you miss 2 weeks, you are fucked.
Right.
You are not making that up. You are fucked. um, you know,
And then when it comes to just like doing rounds and stuff like that, if you're somebody who can't stand up for very long or like has to frequently go to the bathroom or,
you are fucked.
these like really simple things, you are totally fucked.
You are. You're fucked. You on your surgery rotation, you are fucked. On your OB rotation, you are fucked. Those are specialties where you are really engaged in physical labor for long periods of time, and often have preceptors who are not sympathetic to
Mm-hmm.
illness. Emergent not emergency medicine, internal medicine, you are working long hours because of continuity of care. And sometimes it's hard to accommodate things.
Yeah.
And when I say hard, it's a whole systemic thing. It's
Yeah.
not like in undergrad where you go and get a slip and give it to your professor and they give you like 2 extra hours on an exam.
Yeah. This is
Like
just baked into medical
it's
education.
baked into medical education. Like if a patient is bleeding, they're bleeding, right?
Right.
Like what are you gonna do? Um, and I do believe that there are ways that at least some
Yeah.
adjustments could be made. I do think that there are probably some factors of the educational process that are probably, I won't say pretty good, but they're in some way necessary.
Right.
Being a physician is a grueling process, and spending those hours on the wards in medical school trains you for that.
Mm-hmm.
I have a friend who was in med school with me who's now an OBGYN, and he's an attending in California, and he still works 30-hour shifts.
Ugh.
And so it's not something that ends when you're a resident.
Right. Well, I
Um,
mean that depends on whether you continue on an
oh, yeah,
academic
absolutely.
medicine or you go
Absolutely.
into private practice or
Right.
something
But
like that.
even you know, it's hard because there's a constant weeding process. It's
Mm-hmm.
baked into medicine. Could we find ways to make it more accommodating? Yes, I think there are ways. Can
But why would we do
everybody do
that?
it? What? Why? Oh, well, system.
Right.
No, there's not enough of us on the inside
Right.
agitating for it. We get pushed out,
Yeah.
and even if manage to make it through, at some point most people get pushed out.
Right.
Whether it's because their partners, when I say partners, their fellow physicians in a practice, don't like the fact that they have to go out every while because they're sick. They get pushed out. I know that there was a dean when I was in medical school who had an illness, a chronic illness, who didn't practice medicine anymore because she didn't have the stamina for it.
Mm-hmm.
She was a family physician, so she wasn't in the hospital all the time or anything. But you still, you are even sometimes the psychological strain of
Yeah.
seeing all these people with all these stories every 10, 15 minutes it gets to be a lot.
Yeah, and I mean, physician burnout is something that is like a hugely hot topic right now.
Right. And some of the issues that we're seeing with physicians right now, burnout, suicide rates, depression, other physical illnesses as well, are things that if we as people, people with chronic illnesses got on the inside, could bring up, bring to light to say, you need to find ways to take care of students. You need to find ways to take care of residents. And here are ways, as a patient with a chronic illness, as well as a student, physician, what have you, know that could be useful to healthy people to take care of themselves. But we can't get in.
Right.
Um, and it's sort
And
of,
also, I mean, if you are a person with a chronic illness in a medical school, um, you don't exactly have the extra time and energy to advocate and agitate.
no. You're
Like
trying to sit.
you're trying to keep your head above water and you
And
don't
at the
have,
same time, not only are you trying to keep your head above water, but you're trying to keep your head down.
right.
And what I mean by that is you want as few people as possible to know that you have a chronic illness
Yeah.
because people will be looking at you as a source of failure.
Right.
You are
And
going to
what
be.
if it's contagious? And I don't mean that as like a contagion of like an illness, but like what if, like, I think that people, and this is true kind of how people deal with chronic illness, other people with chronic illness in general, is that like people are so scared that it's going to happen to them that they don't even want to be around or hear about it because like they're like afraid it will somehow be catching.
Yeah, and I think too the other issue in medicine, and I have to say a lot of these issues, I honestly don't know how, without getting a bunch of people together to start dealing with these. But another issue is the us versus them dynamic.
Yes.
So when you get in, you very quickly learn it's an us versus them, and not necessarily that it's antagonistic, but it's we're the healers and they need to be healed.
Right.
They come to us
It's
for our knowledge.
paternalistic.
It's a paternalistic model. And I know, they're trying more and more to back away from this paternalistic model, but you still, it's ingrained in the educational process.
Yeah.
We are not sick people. They are sick people. Physicians are not allowed to be sick. Like literally, physicians are not allowed to be sick. You do not call in with a cold.
Which is terrible because they are dealing with medically fragile people who like maybe don't have the best immune systems.
Exactly. But, and I think that too is what creates this. Well, you have an ongoing internal struggle if you have an illness and you're in medical school. And, it's different from people who I think have what I would maybe call a fixed disability. And I don't want to offend anybody, but this is how I experienced it because I did know people who had disabilities, like physical, what I call fixed. People who have deafness and they've been deaf since they were a child.
Right. So this isn't something that is changing
It's
on a
not
regular basis
changing.
or
It's not fluctuating.
right.
It's predictable. When you get on the wards, and there will still be people hostile to a deaf medical student,
Oh, sure.
but they know that you're deaf. You will still be deaf, and you will always be deaf. They can accommodate. But with someone who has an episodic chronic illness, today you're feeling good. For the next week, you might feel like shit. They don't know what to do with that. You might end up in the hospital. They don't know what to do with that.
I don't know what to do with it.
Right. And so, when you're dealing with this whole, like, massive system that's not built to accommodate one person who has these fluctuations in their health and in their, ability, that, that it doesn't work.
Right.
And so, when you see these people and they've gotten through medical school with a disability, it's almost inevitably someone who has a fixed disability, hearing loss, or they had a car accident and now they're paralyzed from the waist down, and things like that. Things that are difficult to, overcome, but are
But it's
it,
not a constantly moving target.
it's not a constantly moving target. You know what the accommodation is
Right.
in different situations. Um, So I really, combine that with the fact that people who do manage to get through with chronic illness, and I think particularly, the one that people can get through with is mental illness. They keep their mouths shut.
Yeah. And
So
sometimes the people, because like having a chronic illness or something doesn't automatically like make you a decent person. Some people are just jerks.
right.
And, there are people who are like, well, I was able to do it. So what's your problem?
Oh my, yeah, yeah, exactly. And so, when you look at all of those factors together, we really have to have a really massive shift.
Yeah.
And for the individual people who have chronic illnesses who would be interested in going to medical school, I say, one, please reconsider. And what I mean that is, even when you talk to healthy people, they're like, medicine sucks. I don't want to do it anymore.
Yeah.
So I have to put that in there because everyone I know like hates. They're like, I like my job, but I hate medicine. I would never do
Yeah.
it.
And it's
I
also, I mean, the whole industry is kind of in flux right now and everything's changing and no one
Yeah,
knows what direction it's actually going in.
right. And the only people really benefiting right now are people who work in insurance companies. I
Right.
mean,
All our pharmaceutical companies.
right, doctors are being fucked too.
Yeah.
So to be fair, I always try to think both sides. Like doctors are getting fucked too. Like
Yeah,
they
for
have all
sure.
these new EHRs they constantly have to learn, and the new coding systems for diseases. ICD-10 came out.
Mm-hmm.
They have to learn it all like immediately.
And all of this while while their office managers are telling them that they need to see more patients because like reimbursement rates are going down, and so you have less and less time to do more and more.
Right. So I have to throw that in there. I remember when I withdrew from medical school, my doctors were like, "Yeah, I don't like medicine. You probably made the right decision." I'm like, "Oh my god, why didn't you tell this to me before I racked up like $100,000 in loans?"
Yeah, that would have been helpful.
So I throw that in there. Reconsider. There's probably other ways you can be helpful, but if you're dead set on killing yourself, um, be prepared. Get prepared before you go to med school. Get prepared in undergrad.
Right.
Like, try to search out schools that might be more accommodating.
Mm-hmm.
Check in with different schools and find out if they have students who might be willing to talk. Find out what disability services or whatever the hell they call themselves. They changed the name here.
Oh,
It's
yeah.
totally Orwellian, but find out what.
Is it the Ministry of Disability?
No, it's student and employee accommodation services or something.
Oh,
It's like,
okay.
how would I know what that's for disabilities?
Yeah.
So find out what the centers are like, what kind of support they provide for medical students. Do not look just at the support they provide because that is useless to you.
Right. And it doesn't, you know, because I had been considering graduate school, and everyone was like, "Oh, just go talk to their Office of Disability Services. They're
No,
super accommodating." I'm like,
no.
"Well, I mean, they're super accommodating in theory, like theoretically that's true, but when it comes down to it, when you're actually, when somebody like me who has varying disabilities, things like that, it's not
Right.
always that cut and dry."
Yeah, and I have to give our office here credit. When I didn't actually reach out to them till graduate school, because I didn't think of myself as having a disability.
Many people
That's
don't.
another thing. If you have a
Yeah.
chronic illness, you have a disability according to Americans with
Right.
Disabilities Act, and probably whatever, if you have a law in your respective country, you have a disability, highly likely under that one as well.
Mm-hmm.
Um, I didn't consider myself having a disability, but I had someone say, "Well, you should check them out," and they did their best. But the fact of the matter is, medical school and graduate school are so much different.
Yeah.
There's only so much they can do. You know, a lot of their accommodations that they work on are in terms of coursework.
Right.
Doesn't work with medical school, doesn't work with graduate school. I'm registered with them right now, but there's nothing they can do for me because I don't take classes.
Mm-hmm.
You know, and in medical school, for example, if you're working on the wards, you know, in the hospital, there's only so much, like, there's nothing they're going to be able to do for you.
Yeah.
They have no pull, right? So you have to check and see what it is they can offer you as a medical student. It may not be very much. They may be the best department for, you know, handling disability in the country, but they may not be able to do anything for you. So you have to check. And if you frankly have a school that's not willing to connect you with their disability services, don't go there.
Yeah. And all of like to say all of this without even acknowledging that you're then going to have to do a residency and possibly a fellowship.
Absolutely.
You know.
And when you move into those spaces, you have even less protection.
Right.
I don't want to use age as the ultimate arbiter, but let's say the younger you are in your career. The younger you are in your career, the more protection you have. As a resident, you're highly likely to have very few places that are going to be openly willing to accommodate you. It's a fact. Until we change the system, it's a fact. So if you want to go to medical school in 2 years, this is the system you're dealing with.
Mm-hmm.
Check, double check, triple check. You may have checked before you went to undergrad. You're going to check a lot more because once you get into medical school, you are going to sign that paperwork for a loan. Very few of you are going to be independently wealthy, so you're going to be taking loans. Once you sign that paperwork, you owe that money. So you want to make sure that you're going to the right place and making the right decision for you.
Right.
And there's nothing wrong with starting and not being able to finish.
Yeah.
But you will pay for that.
Yeah.
I have gotten my, official statements because I'm almost done with school on how much I owe. And I'm not going to be a doctor, but I owe doctor's amount of loans. So, half, because I only did half of it, which is still a lot.
Yeah. It is not cheap at all.
Medical school is not cheap. If you're in another country and it's like really dirt cheap, that's awesome. In the United States, it is not unheard of to graduate with $200,000.
Oh, yeah. No, and that's just for medical school.
That's medical school before undergraduate. And the average for undergraduate is about $30,000. So you're paying a lot for this degree. You want to be sure that you will be supported in your endeavors.
Mm-hmm. And that you'll be able to use it so you can pay off those loans.
Exactly. And it's going to be, frankly, difficult for you to use it.
Yeah.
I know that people who have gone into medicine who either developed them during medical school or went into medicine chose specialties in which it would be easier to have episodic illnesses or to have coverage. Coverage being have another doctor pick up your slack while you are slack in the sense that you're not able to see patients, not in a negative way, but it's a fact. To kind of disappear for a while if you have to. They go into specialties that are more accommodating for that. You have to consider that as well. Mm-hmm. So you may want to be a neurosurgeon, but you're not going to be a neurosurgeon.
Right.
I'm going to tell you that right now.
Yeah.
I think sometimes that people want to be very encouraging to the point that they refuse to acknowledge reality.
Right. Yeah.
You're not going to be a neurosurgeon.
You can't think positively your way into neurosurgery. That's thousands of hours on your feet, staying very still.
7 years of residency among people who are barely accepting women now.
Right.
So
yeah, I mean, well, that's like a whole other thing.
Yeah, and you have to consider all that.
Yeah.
And I really think it's important. I I wish the system was not so punitive
Yeah.
towards people with illnesses, because if there was a way to have some sort of, even if it was like semi anonymous support system for people to talk to folks in different specialties that have illnesses, how they do it. Because there's a lot of specialties where it's just really hard.
Yeah.
You I would advise people to look into specialties where you can work part time without too much, of a disruption. There are some like that. You could be, radiology, like these days, you don't even have to go to a hospital. They just send you the digital images. Psychiatry is one that's easy to do part time. You could, something like dermatology is not necessarily the most strenuous
Yeah.
specialty in the world.
Well, there was like a whole storyline on Grey's Anatomy where they would just like go and hang out in the dermatology lounge, and they had like masseuses and stuff up there. It was really funny.
Yeah, so there are some that aren't too strenuous. I mean, ophthalmology, if you decide not to do surgery, is not bad, you know. Um, of course, ophthalmology, you have to do surgery as a resident, but I think it's mostly sitting down. I couldn't do anything surgical because I have a tremor from the lithium, you know what I mean? So you have to really sit down and think about who you are as a person, what your illness is, or illness, or whatever it is, how they are expressed. You can have depression, but it's not very frequent, and you can easily treat it. Some people have very extended, very chronic depressions, like I do.
Right. And treatment resistant
It's
depression
treatment
too.
resistant. I'm kind of treatment resistant. So it's harder. You have to really be honest with yourself and not just dream about being a physician, because it's like it's way more physical than people think it is.
Yeah.
There's way more. I can't think of what it would be comparable to. It would be comparable. I mean, you're learning a trade, right? It's a trade that makes you have to get like really good grades.
Well, I think it's almost like being an astronaut. You have to
Yeah,
work for years and years and years and years and years and years to get selected for a very selective, program that's very
right.
physically grueling, that there are certain physical requirements.
Exactly.
You
Right.
know,
And it's not to say that you are not smart enough to be a doctor, because I will tell you, you do not have to be smart, as you will know.
I think a lot of my listeners are already
No,
deeply aware of
you are
that.
deeply aware of that. You are deeply aware, but I'm just reinforcing that
Yeah.
for those people who may still feel that it's a judgment on their intelligence. It's not about being smart. Everybody who applies to medical school is smart. Everybody sitting next to you is smart and, book smart, right? They're smart. Um, so it doesn't mean that if you can't get through it that you're not smart. It just means that you don't fit in the system as it stands.
Right.
And if you, do your self-assessment and find that it's not something that works for you, there's stuff you can do out there. I'm trying to figure out what my stuff is right now. And you'll, have to figure out what your stuff is, but you don't have to be a physician to make change in the system,
Right.
because most physicians don't. Most
Yeah.
physicians have no power. You, for example, could be making more change in the system by having this podcast than the physician down the street.
Right. And I have a lot more freedom in that, like, I can express my opinions and
Exactly.
things like that. Yeah.
You're not worried about being castigated for
Right.
it, or losing your spot in the practice, or getting kicked out of the residency, or what
Or
have you,
losing my medical license.
or losing your medical license. And I'm going to point this out for you guys who have mental illness. It is very tough for you, because mental illness in many states is one of the things that can cause you to lose your license.
Really?
And it can actually keep you from getting a license,
Wow. I didn't realize that.
Yes, it
I mean,
can.
I'm not surprised, but I did
Yes,
not
it
realize
can.
that.
Now, that does not mean there aren't physicians with mental illness. What that means is that they're not super vocal about it.
Right.
Even the ones that are vocal about it make it very clear that they are in constant treatment, because you can get into trouble with licensing boards. Um, and if they do ask, do you have a history of mental illness? If you say yes, they're going to ask you more questions.
Mm.
So think about that as well. And it's not to say that you can't do it. There are people that do it. I guarantee you have physicians that have mental illnesses, even if you don't know. But that just means that you make sacrifices if you want to be vocal about the treatment of people with mental illness as a physician and use yourself as an example. You got to think about that.
Yeah.
You know what I mean? Like, I know that I went to a talk by a physician who has a history of addiction. And addiction is very rampant in physicians because you've
Mm-hmm.
got access, right?
Right. You've
So
got access, you've got super high stress levels, you've
you've got
got
the high
like
stress levels, you've got
perfect
access.
storm. Yeah.
And so he developed an addiction and went into treatment. And, he's not practicing anymore
Yeah.
because it's really hard to get it back. And you'll be fighting, with lawsuits forever.
Mm-hmm.
There's a lot that you're up against.
Yeah.
And you have to decide how much it's worth it to you. Or can you do what you want to do another way?
Right.
Changing the system from the inside is expensive and painful.
Yeah.
I thought I was going to do it. No. It's expensive and it's painful. Grad school is very difficult, but there's more flexibility.
Yeah.
Because, once you get out of your coursework, it's really you and your research. If you find research humanities and social sciences, everybody does research. As long as you find research that is flexible and accommodating, you can, and an advisor who is the same, you can get through it.
Mm-hmm.
So if you can, I'm not trying to talk people out of it, but if you can find a way through another graduate education process to make a contribution, maybe go and get a PhD in clinical psychology if that might be interesting to you. There are things that are more flexible that still are, in the healthcare orbit.
Right.
That could help you make changes without having to necessarily be in it and having gone through that extended process of what is veritably suffering for healthy people.
Yeah.
Let alone people with all varieties of chronic illness. So just think really, 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 really hard about why you want to do it.
Yeah.
And if there's another way, you can. Because right now, it's not the best place to be.
Yeah.
I wouldn't, give away the stuff that I learned, particularly in terms of how medicine works, how it is to be a physician, what it's like to diagnose things, to do exams, to talk to patients. I learned a lot with that sort of thing. I don't think you need to pay $200,000 to learn that. I really believe that there will be new programs to teach people those sorts of things. I know that is it Stanford or UCSF? One of them actually has a biomedical graduate, like PhD program, where you do 2 years you do the two preclinical years with the med students. So you take all their classes. And that would include the clinical stuff. Mm-hmm. And so that way you could do it, and you would do it for free. So look into that if that might be interesting to you.
Yeah, that is interesting.
Science PhDs are free in case you have any budding scientists who think medicine is the way to do their clinical research. The best way is to get your free PhD and hook up with a doctor.
Yeah.
I mean, I'm happy to talk about that kind of thing more with people.
Okay.
Um, but yeah, think really hard. Think about who you are and what it is you want from the degree, not getting the degree, not
Right.
being a doctor, but what do you want to do once you become a doctor?
Yeah.
Because when people really start thinking about that kind of stuff, they change their minds. I
Mm-hmm.
know two people, my partner being one of them, who, when they really sat down and thought about what they wanted to do as a doctor, decided, oh, that's I'm not going to be able to do that. And both of them got social work degrees.
Hmm.
So, well, she's almost done. But you got to think about what it is you really want to do. So, do you want to, work with people who have autoimmune illnesses? Well, what is it that you want to do with them?
Right.
Because, as you may know from your interaction with your physicians, you mostly hand out drugs.
Yeah.
So, what is it you want to do? Can you do that another way? Can you become a psychologist and specialize in people who have autoimmune illnesses?
Which would be awesome. We need more of you. Please do that.
Oh, yes, please do that. In retrospect, I would have done that, but I'm not going to school more.
Yeah. All told, like from beginning to end, how long will you have been in school?
You mean like from undergrad or from med school?
Either or not.
I'll
I
do
don't know.
from med school. So I started med school in 2005,
Oh God,
and
that's a
I'll
that's a long
be
ass time ago.
yes, it is a long time ago, and I officially will graduate in the spring. So you can do your math,
Mm-hmm.
and that's what chronic illness does.
Yeah.
So you have to be committed to sticking it out.
Yeah, it's a long haul.
It's a long haul. And, people have told me, like, you're really getting out in about the same amount of time that other people without chronic illnesses get out of grad school. So you shouldn't feel bad. I had to think, like, oh, God, I'm taking forever. But really, I'm getting out in, slightly more than average for my department.
Yeah.
My department's average is 5.5 years. So I'm doing all right. Um, and, you know, I think that it's easy to get down on yourself.
Oh, definitely.
And don't forget that you're walking around with a really, really heavy backpack
Right.
already.
And
Um,
it's so easy to get down on yourself when you're surrounded by all of these super high achieving perfectionists, like
yes,
goal oriented,
exactly.
driven
Exactly.
people.
And if you were someone who didn't come into it with a chronic illness and, didn't have sort of a starting out with a that in your head that you had to accommodate for that in your life, it can be very difficult
Yeah.
to adjust. And I say I've been adjusting for more than 10 years. Between the bipolar and the lupus, like I've been adjusting for more than 10 years. I don't think I'll ever adjust.
I was just about to say that. Like, I don't think that work is ever over.
I've had therapy and I've been in treatment and I have great physicians and everything. But, all I can remember is that person who showed up for undergrad and was like,
Mm.
gonna rule the world. You know what I
Yeah.
mean? And, it's hard to change train tracks,
Yeah.
and like right now, I have no idea what I'm going to do right now. I have no idea what I want to do.
It's a scary place to be, but it's
Is it
also a really kind of cool place to be
It is
because,
both of those at the same
yeah.
time, except when people ask you, well, what are you going to do? I've gotten really comfortable saying I don't know.
Yeah.
Um, but I wouldn't trade it. It's a really expensive lesson. But I do think that in the long run, it's going to have helped me.
Yeah.
Um, and I would love people to go in, and go into the castle and blow it up. But don't please don't kill yourself doing
Yeah.
it.
Don't do it
Don't
at your own
don't
expense.
do it at your own expense because there's so much you can do out there. And if you're science minded, again, I will reinforce PhDs are free in the sciences generally. Definitely People who are interested in biomedical sciences, they will be free.
Mm-hmm.
You will get paid. I get a stipend.
Nice.
That is not small. It's not big, but I do okay. And that's another way you can do it. And grad school's hard too. That's another discussion. But there's a lot of cool things you can do, and most of the stuff, like the drugs you take and all that stuff, developed by scientists, not doctors.
Excellent point. And thank you so much for listening to this episode of In Sickness and in Health. You can find more from us at insicknesspod.com and on social media at insicknesspod. Please rate and review us on iTunes. It helps other people find the show. And don't forget to be excellent to yourselves and each other.